Hello, I'm Dr. Gregory Walker. I am an orthopedic surgeon. I am a board-certified foot and ankle specialist here at the Carondelet Medical Group. My father's an obstetrician and gynecologist, and when I was 4 years old, he took me into the operating room with him, dressed me up in scrubs, put the surgical cap on and a mask and everything, and I saw a cesarean section and a C-section. And that was my first introduction to medicine, and I was fascinated by it. And I was a huge daddy's kid. And so ever since I was young, I wanted to be a surgeon. So when you do orthopedic residency, you train in all aspects of orthopedic surgeries. I do trauma surgeries, I do deformity corrections, I do things like ankle replacements, treating arthritis. I take care of a lot of sports injuries. So you might have heard about some of the Achilles tendon tears. I take care of a lot of different pathologies of the foot and ankle, and I find it to be fascinating. I usually try to greet patients with a smile, no matter how bad my day is going. I just want them to feel like they're appreciated because they came to see me, and I'm honored when someone comes to see me to help them out with their problems. So I hope they feel like that I was kind. I hope they felt that I was honest and someone that they can depend on. I learned my philosophy of care from my father. And so I think of, if I'm going to operate on a patient, is this something that I would do to my mom or my dad or my sister or my family member? If the answer is no, then I won't do it. I will try to exhaust all non-operative means as long as you're happy with that game plan, and I think it's reasonable. There have been a bunch of different innovations in the world of foot and ankle surgery over the last 20 years. A lot of people don't know that you can do ankle replacements for treatment of arthritis, because previously we used to treat a lot of patients with just fusions, and now we can give them some resemblance of a better quality of life with better range of motion and still get great pain control. There is a role of 3D printed metal implants now for patients who have had bone loss or substantial injuries. I really enjoy the Tucson community. My wife is really happy here. My 4 children are pretty happy here. I think Tucson is a unique place to live because it is a major city, but it still kind of has a small town feel to it. I find people to be very personable and very social here. People who work here at the Carondelet Medical Group are very happy, and they tend to not leave because of the culture and environment that Carondelet Medical Group fosters. And I'm really looking forward to joining that team. The teamwork aspect is, at the forefront in terms of everyone knows their role, everyone functions in their role well, and it's not about themselves, it's about taking care of the patients.